Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson WOLFF. Tonight we're joined by Dr. Jinda Wu, who is our Bexar County Local Public Health Authority, as well as Dr. BRYAN, ALSIP, who is the Chief Medical Officer for the University Health System. This is our COVID-19 update for the San Antonio community. We are reporting tonight 325 new cases of COVID-19, which brings our total to 41,939 in our community. Good news is that we also converted all the data, so the 325 new cases is a firm number for us tonight that we're reporting. Unfortunately, we also do have 12 new deaths to report, which brings our total above 400 for the first time at 406. Let me go over their demographic information. We have 6 Hispanic males in their 50s, 60s, 70s, 80s, and 90s. 5 Hispanic females in their 50s, 60s, 70s, and 90s, 1 white male in his 80s, and 1 white female in her 90s. 4 of these deaths were associated with a congregate setting, the Landing at Stone Oak Senior Living Facility, within the last 2 weeks. So again, these are loved ones, family members, friends, neighbors, colleagues. Let's all do our part to keep each other safe and healthy, especially the most vulnerable among us. Over in the hospitals tonight, we were just recalling before we went live, this curve doesn't go down nearly as fast as it goes up. So keep that in mind. We got to keep our efforts up to get these numbers down, but they are starting again to trend in the right direction. We're reporting 801 people in the hospital tonight, down 16 from yesterday. 79 new admissions to the hospitals, which is up from yesterday, and our 7-day average of new admissions daily is now 72. We are flat in the ICU and on ventilators, 345 folks on ICU tonight, as well as 238 on ventilators. Both of those numbers, again, unchanged from yesterday. In terms of capacity, we have 50% of ventilators available and 13% of staffed hospital beds available, and our hospital system remains under severe stress. Total proportion of admissions that are accounted for COVID-19 is 21%. So again, keep up the hard work. It is beginning to pay off, but we are not out of the woods yet. A lot of work yet to be done. And let me make a reminder, wearing masks and physical distancing are our way to get through this. And as a reminder, physical distancing doesn't mean just strangers. If someone is not part of your household unit, please keep your distance, 6 feet of distance, and wearing masks is vital in this point in time in this pandemic. Let me turn it over to Judge Wolff.
Yeah, thanks, Mayor. And like you say, it doesn't go, doesn't get better as quick as it did when it got worse. We're still sitting around 15%. We need down to be about 5% of those that are tested to be negative. And we're still taking 21 days on doubling, where we need to be around 30. I brought this picture now. This is in Georgia, not here, and I know our school leadership is not as backwards as theirs or their governors is backwards also, but that's what it looked like in a school that had a large attendance, mostly teenagers, all jammed up together in a hallway. That's what's going to be hard to police once our schools start, particularly our bigger schools that may have 2,000 or 3,000 students. Unfortunately, the student that took the picture of that was suspended for 5 days. The one student that did the right thing is the one that gets in trouble. So we just need to be very careful as we open them up. The Texas Health and Human Services put out a new directive where you'll be able to visit your loved ones in a nursing home or a long-term care facility. Now, there will be some restrictions on it. You have to be outside visits, no contact between the two, and the facility that you may go to has to have no confirmed positive COVID cases in the last 14 days and no active positive cases with residents. So there may be that opportunity. You can check with the nursing home or long-term facility to see if they meet that criteria, and you'll be able to go in and see your loved one.
Okay. Thank you very much, Judge. And again, keep up the hard work. We are beginning to see some break in the data in a good way, and we need to keep that going because it's just not going to go down as fast as it went up in terms of the infection rate. And if we want to get to schools and we want to get to opening up activities, we've got to get the transmission rate down. Again, the last time we reported it was at 15%. We need to be below 5%, and it's coming down slowly, but keep up the hard work. As always, you can subscribe to the latest updates on COVID-19 in our community by texting COSAGOV COSAGOV to 55000, or you can go anytime to the website at covid19.sanantonio.gov. A lot of great updates and surveillance data on that website as well. So if you haven't been in a few days, it's changed with a lot of good information. You might want to check that out. So at this point, we can go now to questions for me, the judge, Dr. Junda Wu, as well as Dr. BRYAN ALSIP.
I'd like to start off with the hospital numbers. They seem to be going on the right track. Can you give us your assessment on that and, this downward trend that we're seeing?
Yeah, I think like the mayor and the judge said, they're coming down, but not at the rate we would like to see them come down. I think also what's notable is that even though the total number have come down, our ICU numbers are relatively flat, and so that seems to be more plateauing than continuing on a decline. And as you know, those are the most acute patients that we're taking care of, the ones that are most seriously ill. So that's something that we're very aware of.
We know that some of the tools that we're now seeing on the COVID-19 dashboard are the school safety indicator. Dr. Wu, we were watching the virtual town hall with you yesterday. Do we plan to see any other amendments to the current health directive?
Yes, we're going to put out one by tomorrow.
And I know that you had also mentioned that the risk level right now for schools is still very high, but school districts like Comal County ISD still plan to reopen, and it's optional for parents and students. But for those that will be going back into the classroom, what do we want them to know about the current situation at this time?
Comal is concerning to me. I find their rates relatively high, and I think they should also be looking at the public health metrics for their whole county and their district, and maybe thinking about holding back until they also have a positivity rate of less than 5%.
I want to go back to hospital numbers real quick. We had mentioned yesterday that 24% of the total COVID cases in hospitals are from people outside of Bexar County. Did that percentage go up, let's say, within the last couple of weeks, and do we plan to take in more patients?
No, actually, the percentage of COVID patients that we take in outside of Bexar County is relatively stable. In fact, it's not much different from what we see pre-COVID. As you know, we're a large referral center for Central and South Texas, and so we get patients referred not just to university, but to all the hospitals and health systems. And so we look at those data, and we also are very responsive to those needs in the rural areas simply because we're often where they need to go to send patients to higher level of care, and COVID is no different. And as you've heard, they've had some serious challenges just like we have during the past several weeks. So I think it's really helpful that we continue to open or to keep that communication open and be responsive to their needs because we all take care of the same patients.
It's relatively stable. Is this the right area where we're at 24%?
That's historically what we would normally see from outside of Bexar County. It varies by hospital. Some hospitals actually have a lower percentage outside Bexar County, and some have higher, but that's about what it balances out to if you look at the 7 major systems.
Are we getting patients more from a certain area than others?
We've gotten some from Laredo recently. Previous to that, we'd had some from Eagle Pass. So I think it varies along with how the pandemic is affecting each of those particular hospitals.
Going back to the town hall really quickly, there were thousands of people watching last night, but with there being millions of people in the city and surrounding areas, how are you guys working to get the word out if there are any concerns for people who might not have been able to make that town hall last night?
We're also going to be putting up frequently asked questions, and we can also, I actually have to go back and check. I know we talked about doing an essay speak up survey as well for all the people who couldn't make it.
We have a text question from Nancy Tenejero at Telemundo. Could we get your thoughts and reactions regarding the announcements from the Texas Health and Human Services Commission on limited visitations for nursing facilities and long-term care facilities?
So from what we can see so far, the fact that they're going to have it be limited to outdoor visits at places that don't have an outbreak, at places that haven't had any cases for 14 days, and that there won't be any direct contact, that's all very promising. I mean, nothing about this is easy for people who have been suffering, unable to see their family members. I understand why we want to look for another compromise, as we're going to be living with COVID for a long time.
from Krista Taralba at the Express News. Have our higher education institutions been working as closely with Metro Health on their plans for reopening as the K through 12 schools?
I would say we're starting to get to where we're going to be working very closely with the schools. And yes, we have been talking to some colleges and universities as well. I think for colleges and universities, it's a lot easier to enforce the classroom part of things, but it's the get-togethers and, parties or other kinds of congregations that we would worry about the most in a college or university setting.
How do you feel about the plans from our colleges and universities, and what sort of metrics should be used when universities start bringing back students to dorms and athletes?
It would be very similar to what we recommend for the rest of the community, which is something that's modified and limited until we get to where all the metrics are reassuring, right? Where our overall metric is in the green range again.
With the hospitalization in pediatric cases, we see the number is 81. Do we have an age breakdown of that number?
And that is, by the way, a cumulative number. It is not for the last, for the right now, because I know that there was some misunderstanding last night. I want to say they range everywhere from infants to 17 years.
So wait, the 81 number is not where we stand right now in the county?
That's correct. That's the cumulative number
From this,
from this pandemic. So from whenever we started counting in February.
so then where do we stand right now?
I don't have an answer for right now. We might be able to get that. Yeah.
Yeah, I mean, those data are collected. I'm sure we could get those figures. As Dr. Wu said, that's a cumulative number, so the relative proportion on any given day is smaller.
You're trying to get demographic data on the census in the hospital right now.
In terms of the pediatric cases, because
Yeah.
but now I'm confused because last night Mario had mentioned that that within this number it was 62 last week and now it's at 81 this week. So is that right?
That is right. It has increased that much in the last week, correct.
Okay.
When it comes to the new data system, the Texas Health Traits data, you said today it's been fully transitioned. I know in the past we heard a backlog was a possibility. Have you guys seen an impact on that at all?
Have we seen an impact on the backlog? I mean, the impact of the backlog, which is from when you transition from one database into another database, everything's got to be on pause for a little bit while the data dump happens. I think the effect has been in these numbers that you've seen fluctuating a bit more than they usually do, or numbers that were lower than they have been normally.
Yeah, we had a couple days over this last week. One of them was, I think we reported 56 cases one day, another was 150. Those we were cautioning people were artificially low because of this conversion, but that conversion now is done. So we should be getting a regular set of data, which is also still going to fluctuate, but it's not going to be because of the data conversion.
Would any potential backlog numbers be coming in then, or is it like we're done with the backlog?
Well, there's always backlogs at the labs, so it's depending on when those labs start to report to Metro Health. But there was an additional conversion that was pausing the data altogether, and that's what was creating those low numbers. But there is always the backlogs that happen in the labs. These are now real-time data that we're getting back, though.
Krista Taralba with the Express News asked to revisit one of the questions she asked Dr. Wu. Because our universities are opening this month and they're welcoming back hundreds of students and athletes on campus, how do you feel about their reopening plans? Are they doing this too soon?
It might be too soon. I don't know the details for all the dozens of higher educational institutions that we have, but we would be happy to review people's plans. Again, events where there are large amounts of spectators, gatherings, parties, these are all things that we should not be having right now.
In terms of gatherings, we keep hearing that there's a lot of them with 10 or more people at private residences. How aggressive is the city or the county getting on those gatherings?
We're asking people to report them, and this is something that the governor and the judge and I discussed the other day, is that enforcement is something that we've always been doing, and we've got to continue to do, because we can't, as Dr. Wu said, the mass gatherings and the lack of face masks and distance is really what's going to keep this virus continuing to brew in our community.
In terms of the city standpoint, is it SAPD that responds, or code compliance, or who?
It's a combination depending on the time of day or weekend, but the number for folks to call if there is a reported violation is 210-207 SAPD. It's the non-emergency line.
Sorry. In terms of the budget talks that happened today, Mayor, can we talk about something that stood out to me was the violence prevention, the new division created in Metro Health, the reallocation of officers from SAPD to Metro Health. Mm-hmm. Can we talk about why the creation of this division?
Well, number one, we know that work done preventing violence is a lot. There's a lot more return on investment for the taxpayer, and a lot more misery prevented than just simply focusing on responding to emergencies. And so one of the offshoots of the discussions that we've been talking about, how we create a safer, healthier community, is the creation of a division that's focused across the board in a multidisciplinary manner on how we prevent violence from happening in the first place, from domestic violence to mental health to safe, healthy neighborhoods.
These team members, from SAPD to Metro Health, are these officers?
So no, because this is so there's some crossover with SAPD, but the Violence Prevention Division is now a part of Metro Health, and it's again part of the strategic plan for Metro Health to look at how we create safer communities, from adverse childhood experiences to domestic violence prevention, and this is an offshoot and really a growth of all that work.
And we've had a great success, I think, with San Antonio Police Department as well as the Sheriff's Office in working with officers to be able to identify a mental health issue when they get to someone's home or wherever, and to handle it in a way that prevents the violence. And we've had a lot of diversions. Instead of them taking them to the jail, they've taken them to the treatment center over there by Haven for Hope. So within the police department, we've had a lot of good experience with officers also trained to try to prevent that violence.
Even though there is revenue shortfalls within the city budget, there's no proposed, in terms of employees, no layoffs, but furloughs for next year. Can you
Potential
talk about
furloughs, yeah.
potential furloughs? So that's not set in stone.
No, and we're going to do everything we can to avoid that. Again, something that we are proud of, though, is that this budget has no layoffs for civilian workers. We're a bare bones budget on a normal year. In a pandemic, it's even tougher. But this is a budget that I think delivers the services that our residents expect, and also in a more equitable manner.
Dr. Wu, we had reported in mid-July, we got the number that there were 211 babies 12 months and under that were infected with the virus, and there were 700 cases of kids between 6 and 10 years old. Do we by chance have an updated number?
I'm sure we do, but I do not have that off the top of my head. But if you put it through, our PIO, we can get you that. Yeah.
Do you know at all if there's been an increase within that age group in terms of total COVID cases?
Well, we know that even from a few weeks ago to this week, the percentage of pediatric cases it rose from, I mean, it's very small, but it went from like 11% to 12%, but which may not be a real increase, but that is a bigger number than it was back in June. We have seen a steady increase in the percentage of pediatric cases.
What does that say to you with that just slight increase?
Well, honestly, something from 11% to 12% doesn't say much to me other than keep watching it. But over time, we have seen nothing but an increase in that percentage, and that's concerning.
I think that is if you're going into back to school and that being top of mind, right?
Right. It does demonstrate that children can be infected. They're usually not, but they also, I don't know any child who's able to quarantine or isolate in their household. So there's also the exposure to all the members of that household that we worry about too.
Dr. Wu, when you say that y'all are starting to get to where we're working closely with the universities, is it correct to understand that they have not been involving Metro Health in the reopening plans until recently?
No, no, please don't say that. They've reached out. I would say that any number of businesses, nonprofits, higher education institutions, many organizations have reached out to us, and we've been working with the economic transition team to see what they can do to help with that, because there is a lot of information online, both from the state as well as from the health transition team report and the economic transition team report that provides the basic outlines, and we'd love people to look at that first, and then we can point them in the right direction for further assistance if we can't assist them.
There were a number of people who spoke at the budget hearing and had some comments in regards to no action on police reform. I don't know if you guys wanted to comment on that or.
I said a lot in the morning. There's going to be a lot being said between now and budget adoption. And keep in mind, this is the start of the budget process when a proposed budget is put forward. But I would disagree with the characterization that we have done nothing. There's a lot of work yet to be done. But keep in mind, when we started this process, our public safety budgets were growing 2.5 times faster than city revenues. And the problem with that is that when you do that, you crowd out other departments and you force them to disinvest in their communities. When people are discussing how do we make proper investments in our community, how do we ensure that we're not just creating poverty and then having to police it, we're talking about making the proper balanced investments in infrastructure, services, education, health, and that's what we're starting to do with this budget. This is the 7th largest, most populous city in the country with a $2.9 billion budget. In order to make systemic change, it's going to take some time, and we've begun that effort. And the steps that we are taking now are significant. They're not all of it, and some may consider it not enough, but we are making those steps now, and I encourage everyone to get involved. Make their voice heard during the community budgeting process. We are simply not done, and we're going to work all the way up till budget adoption at the middle of September.
Mayor, going back to the large gatherings, I read that the LA mayor is considering, is actually cutting off power at these gatherings. Is that something that you or the judge would consider doing?
Again, if we focus on the punitive and simply on enforcement, then we are missing the point. We have to get people to understand that this is behavior change that we're after. And if you don't get the message that this virus is transferred from my mouth or my nose to your mouth or your nose through droplets that can simply be blocked by keeping distance and or wearing a mask, then we're missing out. If all we have to lean on are tickets and fines to win this pandemic, then we've already lost. But yes, we are serious about citations and we are serious about enforcement for the most egregious offenders. And we have already shut down businesses that have simply flouted the law, flouted the orders, and we will continue to do that. But let's be serious now. We can't do this, especially here in Texas, by simply relying on enforcement and punitive measures to win this pandemic.
Two different fines are difficult. The one easier to enforce is the one on business, because they have to post the notice out there. They have to require someone coming in with the mask and their employees. So it's, a little bit easier to go out there and identify, are they meeting those minimum requirements? It's another thing to track down an individual somewhere on the street where you see him and give him a ticket for $250, particularly when you have to give him a warning. That's very, very hard to do. Easier with the business, but harder to do with the individual.
Have you seen an uptick in the number of calls to report individuals since you all, in the last couple of weeks, had asked people to call in?
I have to check on that. We do get a report on calls and citations issued pretty much daily, and it's kind of been really, really volatile, but I'll look into that because that is a good question.
And Dr. Wu, just going back to your health directive, obviously we know that virtual learning is expected to continue up until September 7th, but some places have created alternatives to the classroom where kids can access virtual learning with a small group of students, of course. Do we believe that this is a safe alternative, and what can people do to mitigate the risk?
Having smaller groups is one way to mitigate the risk, social distancing, promoting hand hygiene and mask use. And I mean, it's not anything that we haven't been saying all this time, but it's hard to set all of that up in a school, right? Providing your teachers and other staff with adequate PPE, making sure your ventilation system is good. Those are some of the other things. For schools, transportation is a challenge, is making sure that your bus isn't crowded. So there are some special challenges around schools.
I know the Boys and Girls Club is looking at a program, and I think they're hopefully will implement it. I think it's a good one. If you have someone that is not able to do the distance learning because of their issues that they may have at home, where maybe the parent's not there, or maybe they don't have the right technology, I think they're going to offer a program where you can go to their facility in very small groups, no more than 10, and spread them out and be able to do the distant learning from there. I know they're looking at that. I think that's better than having the kid that can't stay home sent to the bigger school. I think that's probably a better way to do it.
I know there are YMCAs across the country doing that too, but
Yeah.
we need more places like that, really,
Yeah.
because childcare is a huge gap.
Is there anything that we'd like to say to the families that may not have that alternative, that may say that the classroom, it may be their only choice to send a kid to the classroom to access those tools? I know you mentioned that was one of the at-risk groups that we look at right now.
Which was one of the
The students that don't have any other option other than to go to the
Right,
classroom.
right. So, yeah, the learning centers like that, I think whatever the creative people in our community can do to come up with more safe learning centers like that. I don't know if the answer is to do them in churches or what other spaces, but childcare is absolutely an issue that is, in the same way that we're asking police to do a lot of things that aren't really policing. I certainly have heard a lot from people who need the schools just because they don't have childcare.
Thank you.
Thanks, everybody.